guys, it's Dr. Denney again. Today we're going to chat a little bit more about parasites with your dog and why it's so important to know kind of what they are, how we treat them, and when your dog needs to be seen to get them taken care of. And today helping me out, asking me some questions to help us with this discussion is going to be Maddie, one of my veterinary technicians.
Dr. Denney, how old does my dog need to be to start parasite prevention?
So puppies, actually. So most puppies by anywhere from 6 to 8 weeks old will need to be dewormed, like with an oral dewormer for intestinal parasites. That's something either the breeder does or we do. I also recommend starting flea and tick prevention, like when they're 7 to 8 weeks old and continuing lifelong. It's really, really important. So pretty young in life.
What are intestinal parasites and how do I get rid of them in my dog?
So intestinal parasites, there's a whole list of them. The most common that we see are roundworms, hookworms, whipworms. There's one called coccidia, giardia. There's a whole list. Hookworms are microscopic. They're a blood-sucking parasite. These are not ones that you're going to be able to see in the stool. Common signs of hookworms in puppies is going to be diarrhea, weight loss, and in really severe cases, anemia. I've had to give a blood transfusion to a puppy before because of hookworm infestation, so it's super important to get these guys screened. Roundworms are long, stringy, white. They look like, not to be gross, but we're going to get a little gross. They look kind of like spaghetti. Those are visible to the naked eye. If you see those are roundworms. They're not blood-sucking parasites, but they do steal nutrients from the pet, so they eat the food that the pet is ingesting. They take up space, and if there's too many of them, they can actually cause a blockage in the intestines. So symptoms you could see coming out in the stool. Sometimes the puppy will vomit it up, which I think is really, really gross, but it's part of being a veterinarian. Sometimes we deal with gross things. A lot of the other parasites are going to be microscopic, like giardia or coccidia, but one of the most common symptoms of intestinal parasites is going to be diarrhea and or vomiting.
What are external parasites and what can I do to prevent them?
So external parasites are things that are going to feed on us from the outside. So in dogs, it's the most common is going to be fleas and ticks.
Is ringworm a parasite?
That's a really good question. So it certainly acts like one, but ringworm's actually a fungal infection. How we test for it is either sending a fungal culture, sometimes you can find it on the microscope on a slide, and sometimes about 40% of ringworms will light up under black light. So I like to call it my little light show in exam rooms, and it's pretty cool when it just lights up.
How will a veterinarian diagnose internal parasites in my dog?
So generally it's an intestinal parasite screening. So we get a stool sample. Most parasites will shed their eggs in the pet's stool, and so going ahead and doing a fecal and looking under the microscope after it sits and floats for about 10 minutes or sending it out to the lab to be centrifuged so the eggs float to the top is generally how we get a diagnosis. It's also important to note that not all parasites shed eggs all the time. So they have life cycles. So if you have hookworms or roundworms or tapeworms, those eggs aren't going to be consistently shed all the time. So it can be that's why we check multiple fecals on puppies, or why it's recommended. Because maybe the first fecal we get when the puppy's 7 weeks old is clear, but we recheck again in 4 weeks for boosters at 11 weeks old and we see roundworms or hookworms, and it was because those parasites weren't simply releasing eggs into the stool at that point in time. So that's why it's so important to have puppies checked regularly, and then also that's why it's part of your yearly annual, because you can pick them up from the environment. We do have a lot of wildlife, and unfortunately, we can only do so much to protect our pets. Heartworm prevention is also really important, and a lot of the heartworm preventatives actually have dewormers in them. So most of the time, your pet is getting dewormed once a month. Thanks so much, guys. And if you have any questions about intestinal parasites or if your pet's having diarrhea, please feel free to give us a call.